Hi, everyone. My name is Matanya Burnett.
I'm Cara Beatty.
Our group's presentation is on the psoas major, which is one of the main muscles involved in hip flexion and also plays a major role in posture and stabilization because it attaches to the lumbar spine. I'll also be comparing it to the sartorius since they both flex the hip, but they are very different muscles. The psoas major originates from the lumbar spine, especially T12 through L5, including the transverse processes and the vertebral bodies. It inserts onto the lesser trochanter of the femur, blending with the iliacus to form the iliopsoas tendon. Compared to the sartorius, which runs from the ASIS to the medial tibia, the psoas major is a deeper muscle and has a much stronger role in hip flexion and lumbar stability. The psoas major and sartorius can both flex the hip, but the biggest difference is that the psoas is a deep, powerful hip flexor, while the sartorius is a more superficial and crosses both the hip and knee. Sartorius starts at the ASIS and runs diagonally down to the pes anserior on the medial tibia, so it helps create the figure four motion with hip flexion, abduction, and external rotation. On this slide, we're demonstrating the isolated concentric action of the psoas major, which is hip flexion. Hip flexion is when the femur moves towards the pelvis to isolate the psoas major. We're keeping the leg in a neutral position with the knee pointing straight forward. Hi guys, my name is Tanya.
I'm Cara.
I will be demonstrating how to do the specific exercise, but Kara will be explaining the entire movement and how to do it properly.
Okay. Today we're demonstrating the isolated concentric action of the psoas major, which is hip flexion. So we're going to begin seated with our hips in a neutral position, the thighs down against the bottom of the chair. You're going to keep your knees pointed straight forward and your feet relaxed. To isolate the psoas major, we're going to keep the leg in neutral. Be no abduction or external rotation. So we're not letting the knee flare out like the serratus. As the knee lifts upwards, the psoas major is shortening, which is a concentric contraction. Perfect. Then we're going to remember to keep our core tight and our chest up straight as we lift that knee up towards the sky. We're going to place the back down on the ground. Perfect. This is the isolated concentric action of the psoas major and hip flexion. When the knee falls outwards into a figure four position, it brings more into serratus. So to keep the knee straight forward to focus on the psoas major.
Now, our next video will demonstrate the integrated eccentric action of the psoas major. Since the psoas major is a primary hip flexor, it works eccentrically to control hip extension as the leg lowers. In our video, we show that this by lowering the leg slowly from a straight leg raise. Now we're going to demonstrate the integrated eccentric action of the psoas major. The psoas major is a hip flexor, so eccentrically it works to control hip extension as the leg lowers. So the starting point, we can start by the leg is raised, hip flex at about 30 to 90 or 60 degrees angle. Knee is going to also be straight or slightly bent if needed. And then the end point for this specific exercise would be the legs lowered back to the floor, and then the hips move toward the neutral extension, and then control the whole way, no dropping. So first, I'm going to have you lie down on your back so you find one leg's going to be straight out while the other is bent. Good. So you're going to lift the straight leg up to about 30 to 60 degrees. Good. As the leg lowers slowly, I'm going to count for like 3 seconds down. So 3, 2, 1 as we lower the leg. You don't want to sling it back down to that neutral position. 3, 2, 1. Good. That slow controlled lowering is the integrated eccentric action, controlling the hip extension. A cue for this is like to keep the leg neutral, don't turn it out. I'll have to demonstrate that one more time and I can probably do this exercise. Good. And you want to hold for about 20 to 30 seconds. You know, as I mentioned, for the eccentric motion, you want like that 3-second lowering phase. Lower.
3, 2, 1.
Perfect. The psoas major can work isometrically to stabilize the lumbar spine and pelvis. Since it attaches to the lumbar vertebrae and it crosses the hip, it helps maintain trunk and pelvic control during standing posture, walking or running, planks or core training, and single leg stance movements. The primary antagonists of the psoas major are the main hip extensors, like the gluteus maximus and the hamstring. These muscles are considered antagonists because the psoas major produces hip flexion by bringing the femur toward the pelvis, while the glute max and hamstrings produce hip extension by driving the femur backward. A simple example is walking or running. The psoas major's extensibility can be measured using the Thomas test or modified Thomas test. This test assesses hip flexor tightness, especially the iliopsoas, which includes the psoas major. Manual muscle testing for the psoas major is performed with the patient seated upright and the hip flexed to about 90 degrees with knee bent. The examiner applies resistance by pushing downward on the distal thigh, which challenges hip flexion.
For the differentiating psoas major from serratus, comes down to the hip position. To emphasize the psoas major, the hip flexion should stay neutral, with the knee pointing straight forwards. If the hip starts to abduct or externally rotate, like in a figure 4 position, the serratus becomes more active. The isolating stretch exercise, similar to what we explained before, the video shows a therapist assisting modified Thomas stretch to lengthen the psoas major. The client is positioned supine near the edge of the table with one knee pulled towards the chest, stabilizing the pelvis and reducing compensation. The other leg is guided into hip extension, which places psoas major on a stretch. Isolating activation exercise for the psoas is a drill that focuses mainly on pure hip flexion. The movement is performed seated with an upright posture, lifting the knees straight upwards towards the chest and lowering it slowly and controlled. The psoas major is heavily used during walking and running, especially during the swing phase of the gait. During the swing phase, the psoas major contracts to flex the hip and either bring the thigh forwards so the leg can advance and prepare us for the next step. Potential injury or dysfunction of the psoas major can often be referred to as psoas syndrome. It's kind of an iliopsoas strain or tendinopathy. It usually presents as deep anterior hip or groin pain and can range from mild, strange to severe tearing. It often occurs from repetitive overuse in activities like running, sprinting, dancing, or jumping. It can also happen from trauma, such as sudden change in direction, or falling or lifting. These are 2 higher level test questions we chose based on our presentation over the psoas major. Both questions focus on functional application instead of just memorizing the origin, insertion, and actions. And then here are our references.
Thank you.
Thank you.